guys, I'm back again. So let's move on with what we started. So next will be our nursing orders. Okay, now with the nursing order, it's just a list of things you're going to do for the patient so that the patient gets better. Okay, so right now our patients have pain in the abdomen. So what can we do to help our patient? What are the things that we are going to do? So let's move on with the first one. So we reassure patients that he or she, depending on your patient, is in competent hands of professional health workers. Okay, so we reassure the patient that he's in good hands and everything will be all right. Okay, our next will be to assess the level of pain. Remember, you said at your objectives outcome criteria that the nurse is going to assess the patient's level of pain and realize that it has reduced. So you assess the patient's level of pain. Mostly nurses, we before going into any other activities or things to do for the patient, we normally assess first. We assess the condition. So you assess patient's level of pain using a scale of 1 to 10. So you tell the patient from a scale of 1 to 10, how painful is your tummy? How painful is your stomach or abdomen? Okay. Now after this, what you can do this is to provide some comfort. Okay. So make patient comfortable by placing patient in a suitable position or placing patient in favorable position that minimizes pain. Okay, so you can do this for the patient or whatever other that comes to your mind that you can do to actually help relieve this patient of this pain. Okay. Next, I can prescribe medications. So you self-prescribe medications, and you can write the medicine that you are giving to the patient, okay, for the pain. Okay. The fifth one is to reassess the patient's level of pain again. Level of pain using the same scale, using a scale of 1 to 10 again. So these are the things you can do for the patient. You can go ahead and add more, okay, but mostly 5, 6 is good, okay, good for your exams, and you don't have much time to write about 10 or 20. Yeah, it's just 20 minutes for this whole thing. Okay, so these are the things you can do for the patient. Okay, let's move on to the other one. The patient is a little bit unfamiliar with the environment and can't sleep well. So let's see what we can do. So as nurses, most of the time we reassure the patient that everything will be all right. So first step, reassure patient that he or she is in competent hands. Competent hands of professional health workers. Okay, so now let's get deeper into the problem. You can't sleep. So if you can't sleep, what will you personally do? So that you can help this patient in this condition. Okay, so let's see. Orient patient to the ward and its annexes. Okay, so you can do a little orientation so that at least the person becomes more familiar with the environment. You can open windows to allow circulation of air. You can provide more pillows. Okay. And what else can you do? You minimize noise. So you minimize noise as much as possible so the patient can sleep. So you can go on and on and on and on with the list of things you can do for the patient. Okay. But just as I said, 5, 6 is okay. Now let's move on to the last one. The patient has little knowledge about what's happening to him or her. As a nurse, we can start by reassuring. Okay. So you reassure clients or patients that he or she is in good hands. And quality nursing care will be provided. Now, what do you do? Before you teach someone something, you start from known to the unknown. So what does this patient know? So you ask client to briefly tell you something about his or her condition. Next, you add up with more scientific data about the condition. Now you encourage the patient to ask a question. Then lastly, you can ask questions to assess client's level of understanding, then we are good. So this is what you did for the patient. Now let's move on to nursing interventions. Nursing intervention is like the past tense of the nursing orders. So what you did. And the only new thing here will be to add the rationale behind what you did. So after writing what you did in the nursing order, in the past tense, you just add rationale. So that's it. Okay, let's head right into it. So let's see what we did here. So we said we were going to reassure patients that he or she is in competent hands of professional health workers. So let's see what we did. Now, patient was reassured, because I said it will be in the past tense, that quality healthcare will be provided. Okay, so you being in competent hands and we providing quality healthcare is similar. You can choose to write everything verbatim or verbatim, yeah, but then it's the same thing. Okay, now you did this. So what was the rationale? So you can add rationale, your colon, to allay fear or anxiety. Okay, so we did this so that the level of anxiety of the patient will come down a little bit. Okay, the next one, assess patient's level of pain. Okay, so patient's level of pain was assessed using a scale of 1 to 10. Now, why did you do this? Why did you assess the patient's level of pain? Normally we do that, so the rationale, we do that to serve as a baseline for treatment or nursing care. So we need a basis before we move on further. Now, patients, so this was the second one. Now the third one, make patients comfortable by placing patients in a favorable position. So patient was placed in a suitable or favorable position Now, what's the rationale? Okay, so the rationale is to minimize pain. So that's the main reason why we place the patient in a comfortable position. Now, self-prescribed medication. So, prescribed medication was served. Now, what was the rationale? To also minimize pain. So, to minimize pain. The last one, we said we were going to reassess the patient's level of pain. Okay. So, patient's level of pain was reassessed. It's reassessed Now, why will we reassess patient's level of pain? Rationale: to know the outcome. To know the outcome of the nursing intervention. So to know the outcome of the nursing intervention, so the care that we gave, or the nursing care, whatever word you want to place there. Okay, so you do same for this one. So nursing intervention is basically the easiest when it comes to this table, aside the evaluation, of course. Okay, so let's move on with the other ones. So just as you did for this one, so let's move on here. So patient was reassured. So we're going fast because I think you have the concepts right now. Was reassured of quality nursing care. And what was the rationale? The rationale was to allay anxiety. So you can just interchangeably use those words, fear or anxiety. Okay. The next one, orient patient to the ward and its annexes. So patient was oriented to the ward and its annexes. So why would you do that? So that's the rationale: to help patients familiarize with the environment. With his new environment. And the third one, open windows to allow circulation of air. So windows were opened. Windows were opened. So rationale, why? Okay, let's say to make the room temperature suitable for sleeping. Okay, the fourth one, provide more pillows. Now, more pillows were provided. And rationale: pillows are mostly provided to help with comfort, so to provide comfort. The last one, minimize noise. So noises at the ward was minimized. And rationale. Rationale here again is for the sleep, so to promote sleep. So this is what you are basically going to do. You'll be doing the same for the last one. I hope you get how I'm going about these things. So reassure client that he or she is in good hands and quality nursing care will be provided. So the intervention will be the patient was reassured, etc. Okay, ask clients to briefly tell you something about his or her condition. So client's knowledge about condition was assessed. Okay, you let me write something. I think the rationale parts, we've been meeting it we've been really meeting it, so I just want to skip that part and move on with this one. The next step, ask client to briefly tell you something about his or her condition. So client was asked to say something about his or her condition. And what will be the rationale? This will help serve as a baseline to educate the patient. Now, let me chip this in. With rationale, it depends on what you are doing. You don't have to copy anything verbatim. You have to have something in mind. Okay, so why are you doing this? That's the rationale. I hope you get me. Okay, so we can move on with the rest. But I think you get the concept now. So let's move on to the last part. I want this video to be very short. Okay. Now let's look at the evaluation. Okay. So the evaluation is everything at the end. So what came up. Okay. So here, if you were able to achieve what you wrote here, the objectives, that after 40 minutes, the patient's abdominal pain will reduce by a scale of 1, then this is how you go about writing it, your evaluation. So this is what you do. Go fully met. Okay. As evidenced by. Then you come here. So just as I told you, the intervention and the evaluation are very simple. So you come here and you write these. This time around, you won't be writing in the ing or the continuous form. You just write in the simple present. So as evidenced by, okay, 1, patient now verbalizes that abdominal pain has reduced a little. Next one, the nurse assesses patient's level of pain and realizes that it has reduced by a scale of 1. Okay, so basically this is what we did here. We write the evaluation with the objectives. I hope by now you already know that with the care plan, some things move together, just like the patient problems move together with our nursing diagnosis. We use it to write the nursing diagnosis. Okay, so the same thing happens here. The evaluation and the objective or outcome criteria goes together. Okay, so you said patient verbalizing that the abdomen. So I hope you get me now. So we use this and this together. Okay. Now that's not all. So after writing this, the only addition here is to add your date. So it was 12/04/21. The time that you finished. So you just add. That was 10:30, right? You add 40 minutes because you said after 40 minutes. Or it could even be more, but not less. You said after 40 minutes. So let's say that it will be 11:10 or something. So let me just make it 11:20. Okay. Or let's go back. Okay, 11:10 a.m. Okay, then you just sign your signature. Then you add your name. So I'm Nurse Daniel. So this is what you're going to do. Now let's move on. So on the other hand, what if you didn't meet your goal or your goal was partially met? So this is how you write it to evaluation. Goal not met. So if you couldn't meet your goal, so goal not met. Okay. So you give us evidence. So why was your goal not met? Now you said the patient will verbalize. So let's see. So the patient couldn't sleep well. Patients couldn't sleep well. Okay, that's why it wasn't met. And the nurse couldn't wait for night shifts. So this is the reason why the goal wasn't met. Okay, so you just do simple. Here you just write the date, the time. So it was 11:50, maybe 40 minutes later. So 10:30. So it will be 12:30. 12:30. Okay. Then you just sign. You write nurse Daniel, or you place your name, you put your name. Okay. So when the goal isn't met, now the goal too can be partially met. So let's look at that instance. Goal partially met. Partially met. So when the goal is partially met, so what do you think happened to not make your goal fully met? Okay, so let's say as evidenced by, let's see, patient couldn't answer about 70% of the questions correctly. Let's say he or she answered like about 50%. So 50% correctly. So, and let's move on to the third reason. And the second reason, nurse assessing patient level of understanding. Nurse assesses patient level of understanding. Okay, so that's it. But then at the end of the day, the goal was partially met because the patient could only answer about 50% correctly. But then the nurse, you were able to do your job. So that's what we mean by partially met. So you do some of your job well, and there is a fault at the other end. But with goal not met, it means both of you couldn't do your job correctly. And you do same with the time and the date. So let's say the same date runs through 12:04, 21, and it was 2 p.m. Okay, you had 30 minutes, so it's like 2:30. You sign, and you just write your name. So nurse Daniel. So that's it. After finishing this part, you quickly go to the third part. Okay. So here he talked about the medications, other treatment, and investigation. Now let's move right into it. So you get this information from the treatment chart. So the patient drug treatment chart. Okay, that's where you get the information from. Okay, so let's say our patient here was on IV Cipro. Okay, so IV Cipro, Fluoxacin, 400 milligram BD times 48 hours. Okay, so you write the date they ordered this treatment or this drug. So let's say it was somewhere, let's check something here. So okay, 20th April, 12th April, sorry. So let's say 12th of April 2021. Okay, so that was when this drug was ordered to be given to Mr. Owusu. Okay, now date completed. Okay, so let's say Mr. Owusu is done with this drug, so you can write the date he completed taking this drug. Okay, so let's say this is 12/04, so you can write 14/04/21. Okay, now let's go into the prescription here, the drug prescription here. Okay, so IV means the drug is to be taken intravenously, so they will pass it through the veins. Okay, so we will need a cannula or a syringe, so it will pass through the veins. And ciprofloxacin is the name of the drug, so the generic name or the brand name of the drug. Okay, now 400 milligrams tells you the strength of the drug, so 400 milligrams. And BD here stands for twice a day, so the patient will be taking the drug 2 times in a day. BD stands for 2 times in a day. Okay, now times 48 hours here tells you or indicates the period of the period the prescription is to be taken. Okay, so how long will the patient be on ciprofloxacin? How long will the patient be on ciprofloxacin? So for 48 hours. So that's a little bit about this prescription. Okay, so you can write as many as you want or as many as there are in the patient's treatment chart. Okay, so let's move on to, let's say maybe on the 13/04/21 there was another prescription. Let's say another IV Flagyl. Okay, whose strength is 40 milligrams, and DLY means daily, so daily, in a day. Okay, per day. Okay, for how long will he be on this drug? Okay, let's say 48 hours. So you can go on and on and on. Now if Mr. Michael also is not done taking this drug, you write not yet. Okay, now let's move on quickly to this part, the other treatment. So at this part, this is the other treatment that the patient is likely to undergo, aside the medical ones that we have and also the surgical ones. Okay, so let's say here maybe the patient is on radiotherapy or something. Radiotherapy, you write it here. So if there are other treatments aside what we are giving at the hospital, you just write it there, maybe radiotherapy or something else different from what we are giving, the care we are giving to the patient. Are we okay? If there is no other treatment like that, you just write no other treatment ordered in this fashion. Okay, so 1, 2, 3, no other treatment ordered. Okay, so we are done. So this side is for other treatment. Okay, now let's move on to investigations, and here you get them from the lab results, so the lab findings, etc. So let's say the first day the laboratory they will take specimen and send it to the lab for the lab scientists to do some investigation. So let's say the same day, 12/04/21, maybe there was this test done, RBC, then write the value. There is always the value there. Okay, so A3 10 to the power 6 UL. Okay. 120421 AGB 13.7 G per DL 120421 HCT 39%, 39.0%, MCV. So they are just findings from the lab result, and you are just inputting them. Okay. So 120421 MCV, and it's, let's say, 80.2 femtoliters, etc. So this is what we'll be doing here. So we've completed with writing our care plan. So we are done. Thanks for watching.